President Uhuru Kenyatta's, the universal healthcare is part of President Uhuru Kenyatta's Big Four agenda. We've had the likes of the UK and the US review the pharmaceutical amendment so that pharmaceutical students study for at least 7 years. Would you say that the country is moving in line with universally accepted standards of healthcare?
I think we are moving, when we pass this bill today and made the amendments, then we are definitely in line because we have done the separation, the pharmaceutical technologies and the pharmacies. So the bill was not really talking about training, except the part of the bill talked about where the pharmacists are trained should be a university that is recognized by the Pharmacy and Poisons Board. The Pharmacy and Poisons Board does regulate training also. So that also was discussed, and it was said it has to be a university, and the curriculum there is recognized by the board. So I think we are in the right direction.
All right. Members of Parliament passing the bill said the main aim was to regulate the cost of healthcare in the country. How is the bill expected to achieve that?
Well, one of the things that came that can affect that is we said that the county governments will purchase drugs from Kemsa, and the openings that you had earlier discussed, that you can compare prices, and that when the drugs are not there at counter, they can buy from elsewhere. That was also removed, so that if we have drugs that are actually sourced from a government entity, and the government entity itself should be efficient, then you can have the cost coming down because of buying in bulk, and then also confirming quality. So in that way, we may have a way of making sure that we have a hand on the cost of drugs.
Right.
But the cost of healthcare is also affected by other things, not just drugs.
All right, but many are asking, at what cost, at what expense, rather, are we looking to regulate the cost of healthcare if the quality of the drugs in the country is to be questioned? Now, this amendment here, especially that directive for public hospitals to buy medicine from Kemsa, it's quite a long document here, but it says that a national and county public hospital shall, in the procurement and distribution of drugs and supplies, obtain them from Kemsa, unless such drugs and medical supplies in the price of such the prices of medical supplies as provided by the authorities exceed the prices offered by other commercial entities. That there seems to be the bone of contention. Health professionals say this will promote the sale of drugs merely on the strength of price as opposed to the strength of quality.
That was removed, and what it was meant to do earlier was that they would buy if the drug is cheaper elsewhere than at the Kemsa. And that was removed because in reality that should not happen.
Right.
If Kemsa is a state agency that is buying drugs in bulk. Then the members felt that it will bring a loophole so that some institutions may just say the drug was not there, so we bought it elsewhere. And it's better to just close that loophole and let them buy there. If Kemsa has a problem, then the country will deal with Kemsa on its ability to make drugs available. But at least quality and price can then be regulated.
All right, and very briefly, finally, a 2016 survey of the National Quality Control Laboratories in the Pharmacy and Poisons Control Board concluded that 30% of all drugs in the market are counterfeit. How does this bill seek to address that?
Well, it is the bill initially had sought to also amend the National Quality Control Lab, but it was felt that needs very extensive review, and therefore that element was actually removed, so that the National Quality Control Lab should actually continue to do what it was doing before.
Right.
When there's a review, then it will need to be strengthened. I know that there are my parts. You see, this thing was done in two ways. One, the original amendment bill, first of all, sought to remove all the functions of the National Quality Control Lab. So all those amendments were actually removed. But at the same time, it had sought that some of the functions that were removed would then go to the board. And when we looked at, there may be one or two that actually stayed, but I think that is something that will be looked up. But in general, the National Quality Control Lab should be able to function, and it is the intention of Parliament, as I saw, that when that review comes, it will be strengthened so that we can be sure of the control of the quality of drugs.
All right, many thanks. Dr. James Nyikal there is the same member of Parliament as well as a member of the Health Committee. Well, let's now bring in the chair of the Kenya Pharmaceutical Association, Patrick Adera. Many thanks for joining us on the big story, the controversial health amendments bill passed by Parliament today. What are your concerns on the same?
I want to thank the Committee of Health for the courage they've had to stand against all forms of intimidation, blackmail by different players in the industry, and to stand for the Kenyans. Having said that, I think it is important that I put some things right. As we begin. One is that I've seen this narrative of pharmacy technicians. In Kenya, we don't have pharmaceutical technicians. What we have are pharmaceutical technologists, as reported by the chair Parliamentary Health Committee. Secondly, the training for pharmaceutical technologists is regulated by the Pharmacy and Poisons Board, and it is a 3-year training, not 18 months. It is a 3-year, full-time 3-year training, plus another 7 months of internship. So it's not 18 months, and it's not technicians. These are technologists trained and regulated by the Pharmacy and Poisons Board, which has accredited and licensed the over 30 middle-level colleges to offer diploma in pharmacy. Having put that right, let me say that to us as an association, this bill has come at the right time. We all know that there has been a lot of confusion in pharmaceutical industry, where there are a lot of mushrooming of illegal outlets. There are a lot of counterfeits, like you've rightfully said. And this bill has come to address some of these issues by instituting heavy penalties on people engaging in pharmacy business without proper licensing, heavy penalties on people engaged on counterfeits and substandard drugs, and also having a requirement that all facilities holding medicines must have pharmacy professionals. And of great importance, like Madam Chair has said, is that for a very long time, despite pharmaceutical technologists being the backbone of pharmaceutical care in Kenya, their representation at the board has been the lowest, 1 against 8 pharmacists. So what this bill has done is that it has increased the presentation of pharmaceutical technologists to 3. That will make sure that whenever the decisions that need to be done, then pharmaceutical technologists' interests are also taken care of. And of great importance to me is that to us, our interest is the patient, the Kenyan, that pharmaceutical technologists have been serving for the last 50 years with a lot of confidence, with a lot of commitment. So this bill, as much as we didn't achieve all that we had requested for, because to us, this bill has come at a time when UHC is a global agenda. And we all know that UHC is about access of quality and affordable medicines. We cannot assure Kenyans of having access to quality and affordable medicines when we limit handling of medicines to a few individuals who are so much obsessed on making money and not serving the clients.
And that brings in the Kenya Medical Supplies Authority Act, Kemsa, which makes it mandatory for national and county public hospitals to obtain drugs and medical equipment from Kemsa. How would you judge the impact of this move on Kenya's healthcare system today?
To me, so far, Kemsa has not performed so well. And I think giving them the monopoly of supplying all the county governments and the national government.
Right.
It means that a lot of investment need to be done by the government. The government will have to pump in more money to Kemsa and to build even the capacity, the human resource capacity, so that Kemsa will be able to offer this very essential service to the counties. If that is not done, then I see a challenge because currently Kemsa doesn't have the capacity to reach out to all the counties and the national government. And that is why for a very long time, most of the counties have been operating between MEDS and Kemsa. And both organizations have quality assured products. They have the right professionals. They have all the approvals that are required. So to me, I thought that the bill could have given both MEDS and Kemsa the responsibility to do that work. So what I think is that the government will have to build capacity at Kemsa so that Kemsa can take up this very important responsibility assigned to them. Yeah.
Drug-related problems are the leading causes of mortality in our country today. There have been many concerns and rising fears over the increasing number of counterfeit drugs, not just in Kenya, but especially among developing countries. At the end of last year, the World Health Organization released a report saying 1 out of 10 drugs in developing countries are counterfeit. We've heard there from James Nyikal, a member of the Health Committee, saying they have put in place laws to ensure, they bar or, they remove counterfeit drugs from the country. Are you satisfied with what has been done by the government?
Yes, so far so good, but a lot needs to be done because looking at the regulator, the Pharmacy and Poisons Board, the capacity at the board is not as we would have expected because looking at the number of the inspectors that we have currently, and the growing population in Kenya and the nature of our borders, you find that even with all the programs that the regulator has in place, still we have counterfeits getting into the country. We have substandard products coming into the country. So I still think that the government need to do more. They need to capacity build the regulator, employ more drug inspectors. But of great importance is that this bill has now come up with very heavy penalties for those that will be found holding or trading in counterfeits and also the illegal outlets. But of great importance to me is that currently, as we all are aware, the wholesale business has been a reserve of the pharmacists. And the question that we keep asking ourselves today, who supplies these quacks? Because these quacks do not get these medicines from heaven.
Right.
They must be getting them from these wholesalers. So to us, we think that it is time that we change our attention from looking at pharmacy business as a money-making endeavor and bring patients into perspective. And a spot check across our cities, you'll realize that most of the wholesales are also doubling as retail. And what that does is that the patients are denied that opportunity to be served by the professionals and to be counseled through on how to use their drugs. Again, what this bill has done is that you'll only be licensed to do one form of business under one roof.
Right.
You cannot have a wholesale license and still do retail under the same roof.
All right. Overall, many questions. Of course, there have been, a lot of confusion over this bill. Overall, especially from a pharmaceutical expert point of view, what is the impact of this bill on Kenya's trip towards universal healthcare?
To me, the bill, one is that I've said that UHC is about access, quality, and affordability. So the bill, one, will assure Kenyans that at any given point, the drugs that you will receive are drugs that have been tested, they are quality drugs, and that these drugs will be delivered to you by a professional that is licensed and regulated by the Pharmacy and Poisons Board. The other thing is that unsuspecting Kenyans will be now be protected against these quacks. You've had Madam Sabina refer to Mugo Wairimu, who has been doing whatever he's doing for a very long time. Right. And unfortunately, our regulatory bodies have not been able to stop what is happening. So with this bill, one is that Kenyans are assured of access and that quality medicines will be available, and that they'll have the right people handling the right drugs, and these drugs will be delivered to them through a due process, that you'll have to be to go through the right systems to have these drugs. That will ensure that abuse and irrational use of drugs is also contained.
All right, many thanks for your time. Patrick Adera is the national chairperson of the Kenya Pharmaceutical Association in Kenya. Earlier on, we also spoke to Dr. James Nyikal, Member of Parliament, Seme, and a member of the Health Committee. That is the big story. My name is Michelle Ngele Odhiambo. Good evening.